Over the past few decades, the number of women giving birth via cesarean section has been steadily increasing. This trend is concerning because while C-sections are undeniably life-saving in certain situations, they are major surgical procedures with potential risks and complications. When chosen unnecessarily, they can pose health risks to both mother and baby. This essay aims to provide expectant mothers with the information they need to understand the differences between vaginal and cesarean delivery. We'll delve into the reasons why vaginal birth is often the safer option, while also acknowledging the critical role C-sections play in emergency situations. Every woman deserves to understand the risks and benefits of both approaches to make the best choice for herself and her baby. A cesarean section, commonly known as a C-section, is a surgical procedure used to deliver a baby. It involves making incisions in the abdomen and uterus to remove the baby. While C-sections are generally safe, they carry more risks than vaginal deliveries. They are typically recommended when vaginal birth might pose a risk to the mother or baby's health. Some common medical reasons for a C-section include fetal distress, which is when the baby's heart rate indicates potential problems during labor. Breech position, when the baby is positioned to be born feet or bottom first. Cephalopelvic disproportion, which means the baby's head is too large to pass through the mother's pelvis. Placenta previa, when the placenta covers the cervix, potentially blocking the baby's exit. And maternal health concerns, such as preeclampsia, eclampsia, or certain heart conditions. Vaginal birth is the natural process of delivering a baby through the birth canal. It is the way humans have given birth for millennia and is generally considered the safest and healthiest option for both mother and baby when there are no medical complications. Vaginal birth allows the baby to pass through the birth canal, which helps to clear their lungs of fluid and encourages the growth of beneficial bacteria. It also triggers the release of hormones in the mother that aid in breastfeeding and bonding with the baby. Numerous studies have demonstrated the advantages of vaginal delivery over C-section when medically possible. These benefits are significant for both mothers and their babies, and are supported by a growing body of medical research and clinical experience. For mothers, vaginal birth is associated with a shorter recovery time, as mothers who deliver vaginally typically recover faster and experience less pain and discomfort than those who have C-sections. This means they can bond with their newborns more easily and begin caring for their babies sooner, which can be emotionally rewarding and physically beneficial. There is also a lower risk of infection, since the incisions made during a C-section increase the risk of infection. Avoiding major surgery reduces the likelihood of complications such as wound infections or longer hospital stays, making recovery smoother for most mothers. Additionally, there's a reduced risk of blood clots, as vaginal delivery is less likely to lead to blood clots in the legs or lungs. This is especially important because blood clots can be a serious and sometimes life-threatening complication after surgery. And of course, there's a faster return to normal activities, with mothers who deliver vaginally often able to resume their daily routines sooner. This quicker recovery can help mothers feel more confident and independent in the early days of parenthood. For babies, vaginal birth offers several benefits, including improved respiratory health, because passing through the birth canal helps to clear a baby's lungs and reduce the risk of respiratory problems. This natural process can make the transition to breathing outside the womb smoother for newborns. There's also an enhanced immune system, since exposure to the mother's vaginal bacteria during birth helps to colonize the baby's gut with beneficial bacteria, boosting their immune system. This early exposure can play a crucial role in the baby's long-term health and development. Finally, studies suggest that babies born vaginally may have a lower risk of developing allergies and asthma later in life. These combined benefits highlight why, when it is safe and possible, vaginal delivery is often the preferred choice for both mothers and their babies. While C-sections are essential and can be life-saving in certain situations, it's important to recognize that unnecessary procedures carry potential short-term and long-term risks for both mother and baby. Understanding these risks can help families make informed decisions about childbirth and encourage open conversations with healthcare providers about the safest options for each unique situation. When we look at the short-term risks for mothers, there's an increased risk of infection, meaning infections of the incision, uterus, or bladder are more common after a C-section than after a vaginal birth. These infections can sometimes require additional treatments, longer hospital stays, or even readmission to the hospital, which can be stressful for new mothers and their families. There's also a higher likelihood of needing blood transfusions, since C-sections often result in greater blood loss compared to vaginal deliveries. This increased blood loss can sometimes lead to anemia, fatigue, and a longer recovery period, making it more challenging for mothers to care for their newborns in those first crucial days. And let's not forget, the recovery period from a C-section is generally more painful and longer than that of a vaginal birth. Mothers may experience increased pain and discomfort, limited mobility, and a greater need for pain medication. This can impact bonding time with the baby and make daily activities more difficult during the initial weeks after delivery. Now, for the long-term risks for mothers, C-sections can cause scar tissue and adhesions to form inside the abdomen. These adhesions may lead to chronic pain, bowel obstruction, or complications in future pregnancies, such as difficulty with placenta attachment or increased risk of miscarriage. Scar tissue can also make any future abdominal surgeries more complex and risky. There's also the risk of placenta accreta, a serious condition where the placenta grows too deeply into the uterine wall, which increases the risk of severe hemorrhage during future deliveries. This complication can sometimes require additional surgeries, including hysterectomy, and can pose significant risks to both mother and baby in subsequent pregnancies. And, although it's rare, there's the possibility of uterine rupture, which is a life-threatening complication where the uterus tears along the scar line from a previous C-section. Uterine rupture can lead to severe bleeding and may require emergency surgery to protect the lives of both mother and child. When we consider the short-term risks for babies, those born via C-section are more likely to experience breathing difficulties, such as transient tachypnea, due to fluid remaining in their lungs. This is because the natural process of labor helps clear fluid from a baby's lungs, a step that's often skipped during a surgical birth. There's also an increased risk of admission to the neonatal intensive care unit, or NICU, since C-section babies may require additional monitoring and care for issues like low blood sugar, temperature instability, or difficulty feeding. This can be a stressful experience for families, as it may delay the first moments of bonding and breastfeeding. Looking at the long-term risks for babies, some studies suggest a potential link between C-section births and a higher risk of developing chronic diseases like obesity, type 1 diabetes, and celiac disease later in life. While more research is needed, these findings highlight the importance of considering the long-term health impacts of birth choices. And finally, C-section babies miss out on exposure to beneficial bacteria in the birth canal, which may affect their immune system development and potentially lead to altered immune development. This early exposure to a diverse range of bacteria is thought to help train the immune system, possibly reducing the risk of allergies and autoimmune conditions as the child grows. Choosing how to give birth is a deeply personal decision. It is crucial for expectant mothers to have open and honest conversations with their healthcare providers to make informed choices based on their individual circumstances. Discussing your preferences, medical history, and any concerns you may have will help you and your doctor determine the safest and most appropriate birth plan. Informed consent means understanding a few important things. First, the reasons for a C-section. If your doctor recommends a C-section, be sure to ask about the specific medical reasons and the potential risks and benefits. Next, alternatives to C-section explore alternative options, such as vaginal birth after C-section, often called VBAC, if that's something that applies to your situation. And finally, your right to refuse a C-section. You have the right to decline a C-section if you feel it is not the best choice for you and your baby, unless it is a life-threatening emergency. The rising C-section rate is a complex issue with no easy solutions. It's a challenge that involves not just medical professionals, but also expectant mothers, families, and the broader healthcare system. Understanding the factors that contribute to this trend is the first step toward making positive changes. However, there are several strategies that can help reduce the number of unnecessary procedures, empowering women to have healthier births. By working together, healthcare providers and families can create an environment where informed choices are encouraged and supported. These strategies include prenatal education, Attending childbirth classes and educating yourself about labor, delivery, and pain management options can help you feel more prepared and confident about vaginal birth. Learning about the natural process of childbirth and understanding what to expect can reduce anxiety and help you make decisions that align with your values and preferences. Continuous labor support is also important. Having a doula or supportive birth partner present during labor can provide emotional support, encouragement, and advocacy, which might reduce the need for medical interventions. This support can make a significant difference in your birth experience, helping you feel safe and cared for throughout the process. Promoting vaginal birth after C-section, or VBAC, is another option. For women with previous C-sections, VBAC can be a safe and successful option in many cases. Discussing your options with your healthcare provider can help you make an informed decision that's right for you and your baby. Avoiding inductions and augmentations when unnecessary is also crucial, since medical inductions and augmentations of labor can increase the risk of complications and lead to C-sections. Always ask about the reasons for any recommended intervention and whether it's truly needed for your situation. And finally, choosing healthcare providers who support vaginal birth. Seek out doctors and midwives who are truly committed to promoting vaginal birth and reducing unnecessary interventions. Building a trusting relationship with your care team can make all the difference in achieving a safe and positive birth experience. Giving birth is, without a doubt, a transformative experience. Every woman deserves to feel empowered and supported throughout her pregnancy, labor, and delivery. By understanding the benefits of vaginal birth, the risks of unnecessary C-sections, and the power of informed consent, women can make choices that align with their values and preferences. Remember, you are not alone in this journey. Surround yourself with a supportive team of healthcare providers, family, and friends who respect your decisions and provide the encouragement you need. While this essay advocates for the many benefits of vaginal birth, it is essential to reiterate that C-sections are life-saving procedures when medically necessary. They really do play a critical role in protecting the health of mothers and babies who are facing complications. The ultimate goal is to ensure that every woman has access to evidence-based information, compassionate care, and the support she needs to make informed decisions about her birth experience. By working together, we can promote safe and healthy births for all women.